give a medication to a rabbit, we can use different routes. We can use subcutaneous one, intramuscular, intravenous, and also sometimes intraperitoneal routes. The first one, the subcutaneous injection, can be done in the loose skin, and the best area is probably the scruff area, but it can also, all the rest of the back can be used for subcutaneous injections. We just needed to gently scruff the rabbit and pull the skin in this way, so we can do our injections, and there is a lot of space on the skin, subcutaneous space. For intramuscular injections, we can use different sites. We can use the epaxial muscle or some sublumbar muscles, and we find this muscle along the spine, just behind the last rib, till the hips. So we palpate the last rib at this level, we palpate the spine, and on each side of the spine we have the epaxial muscles, and we can do the injections on one side or the other side. Another site for intramuscular injections are the quadriceps, and we find this muscle on the anterior aspect of the hind legs in this place here. There. They are quite big muscles, very powerful. We avoid the rest of the leg, the posterior aspect of the leg, just because we have the sciatic nerve that runs along, and we wanted to avoid touching that nerve. For intravenous injections, we can use both the marginal ear vein that runs just along the edge of the pinna of the rabbit, in this position, or with the other ear along this edge. Right in the middle of the pinna, we have the artery. This is the central ear artery, and we do not want to take blood or do injection inside the artery. So for intravenous injection, we can use the marginal ear vein, but we do not want to use the central ear artery. Another place where to do intravenous injection or collect blood is from the lateral saphenous vein that we find again on the hind legs, and it runs in this position. This is the saphenous vein, is really good vein if we will want also to collect blood. Other routes for injections are intraosseous injections, that we can do it in the femur bone or in the tibia, or intraperitoneal injection that can be done into the abdomen of the rabbit. However, this is a blind technique, and it can be dangerous because rabbits have a really well developed cecum, and if we insert the needle inside the abdomen, we do not know what we are touching. So before using the intraperitoneal injection, we should be sure that we have tried all the other routes in order to avoid any dangerous punching of the cecum. If we have to do the intraperitoneal injection, we needed to try to do it in the caudal quadrants of the abdomen of the rabbit. So if this is the umbilicus, the center of the abdomen, we will do it in one quadrant or the other quadrant. In this way, we try to avoid to touch the cecum.